Okay, and next presenter we have Gerald Magnaye. Okay, the title of presentation is Best Management Practice of Selected Hospitals, Evidence from the Philippines.
Yes, good evening, everyone. I'm Mr. Gerald Magnaye from Philippines. I graduated of Bachelor of Science in Nursing in 1997. And I recently graduated in MBA last July 2021 in San Pablo Colleges, Philippines. I am presently employed in San Pablo City or San Pablo Medical Center as a cardiovascular technologist. And I'm going to present to all of you my research entitled Waste Management Practices of Selected Hospitals Evidence from the Philippines. San Pablo City, my hometown, is a first-class city in the province of Laguna, Philippines, that has 4 private hospitals. My study aimed to determine the current healthcare waste management healthcare waste management practice of this hospital, specifically on their specific guidelines, and also to determine the possible changes and adoption of acceptable, if not state-of-the-art technologies of healthcare waste management system. I personally witnessed that not all waste produced by hospitals are infectious or hazardous. With proper management and use of well-known as solid waste management tools such as segregation and recycling, the portion of the hospital waste stream that causes risk and human environmental health need, not because of a public fear. Here is the theoretical framework that is used in my study. In figure shows that the technology acceptance model proposed by Fred D. Davis in 1989. This is used to measure people's intentions of their attitudes. Subjective norms, perceived useful, strongly influence people's intention in using technology. Meanwhile, perceived ease of use also had a small but significant effect on intentions, while subjective norms had no effect on intentions. The conceptual framework of this study used by the input process output model, wherein the demographic profile of hospitals in the input section, the status of their current practice on the process, and Go Green Hospital as an output. The main problem of the study is to determine the current practices in waste management of majority of the hospitals in San Pablo City, Laguna, Philippines. Specifically, it seeks answers to the following questions. Okay, so what is the demographic profile of the following? Sorry. What is the demographic profile of the following hospitals in San Pablo City, Laguna, in terms of category level, and bed capacity? What are the current practices of the hospitals in San Pablo City, Laguna on healthcare waste management system in terms of compliance in the regulatory agencies in waste management, segregation of healthcare waste, handling, collection, and transportation, treatment and disposal, healthcare waste minimization. How the hospital administration and managers implement their process in healthcare waste management system in terms of analyzing the effectiveness of the process, recommending for improvement of the process, determining the factors and contribute the success of the process. Is there a significant difference in the practice of waste management in private and government hospital? What changes can be developed in the process and practices to improve the waste management in the hospital? Research methodology. For the research methodology, this study is qualitative in nature as it is primarily exploratory research. It used an in-depth interviews and analysis, and approach shall be interpretative and emergent findings. This study is conducted in San Pablo City, Laguna, Philippines. Entities involved with the 4 private hospitals, namely St. Francis de Assisi Hospital, the Community General Hospital, San Pablo Doctors Hospital, and San Pablo Colleges Medical Center, and the 2 public hospitals, the San Pablo City District Hospital and the San Pablo City General Hospital. Personalities shall be include hospital administrators and respective heads on their general services unit or equivalent. An interview with concerned individual, example given, hospital administrators, general services heads, and nurses is conducted. The same for other stakeholders as needed, which is used later or validation purposes. And lastly, this study is conducted following ethical principles, ensuring that respect the human dignity and justice and fairness. Okay, the significance of the study, the result of this study, they improve useful not only the local government unit or the LGU of the city of San Pablo City in Laguna, Philippines, but also the hospitals whose operations are within the city. The LGU or the local government unit may be able to use the results of this study in crafting its own guidelines as far as healthcare waste is concerned. Also, the immediate environment and the San Pableños, the residents of the city, will be ultimate winners from the proper waste disposal. Okay, so this table shows that in terms of category, we have 4 private hospitals and 2 government hospitals were included in the study. The San Pablo City has more private hospital than the government hospital to serve their community. Okay, so this table shows the level of the hospitals in San Pablo City. The St. Francis de Assisi, the primary, the Community General Hospitals, the secondary, the San Pablo Doctors Hospital is a secondary, San Pablo Colleges Medical Center, secondary, San Pablo District Hospital, secondary, and San Pablo City General Hospital, primary. Okay, lastly, this table shows that all respondents' hospitals have a different bed capacities and consider a basis for leveling of a hospital such as primary or secondary hospital. On bed capacity as approved by the Philippine Health Insurance Corporation or PHIC, San Pablo Colleges Medical Center had the highest bed capacity in all private hospitals on the secondary level. On the government hospital and San Pablo City District Hospital is 105 bed capacities. A secondary hospital as San Pablo City General Hospital has 32 bed capacities on primary level, while the St. Francis de Assisi have 35 bed capacities, Community General Hospitals 95 bed capacities, the Pablo Doctors Hospitals 50 bed capacities.
Gerald, please conclude your session.
Okay, each of the hospital has their own specific practices. Anchored on the hospital follows the 5 R's of waste management: reduce, reuse, recycle, recover, residual management. Infection Control Committee, compliance in waste management system, strict implementation in the process of achieving the Go Green Hospital Zone, and anchored on the conclusion, which were derived from the findings of the study, the following recommendations are put forward. Plan to go green, create the Infection Control Committee, who is dedicated, hardworking, determined to maintain and strictly monitor the implementation of the hospital waste management policy for the safety of healthcare workers and all the people around. Thank you.
Okay, thank you, Gerald, for nice presentation.